welcome, gentlemen. We appreciate you being here today. I'm Sean Gepper. I'm one of the organizers with Tom, Val, Carlos, and Charles is out of town today. What we do here is we allow people to share their story, and we give them feedback. We ask questions, we give them advice, and we just try to help them move along and learn as we ask those questions. So we'll have that opportunity after our speaker speaks. So thank you for coming out today. It is my pleasure to now introduce Jill Miller, and she's going to share her story. Go ahead, Jill.
Good morning. Hi, I'm Jill Miller. I am a physical therapist and a women's health specialist. I actually grew up here in Ormond Beach, and everybody knows me as Jill. Today I'm going to talk about my background and how I became a PT, and then I'm going to talk about what drove me to become not just a PT, but a women's health specialist. Then I'm going to talk about what the specialty of women's health is. I'm going to talk about what made me transition from hospital-based outpatient to my private practice, and then finally I'm going to talk about what my health can do for me. I'm going to start with a little bit of a story. My audience is younger than I was expecting, but hopefully this is okay. Love you. So I grew up here. I went to Tomoka Elementary School, and in about 5th grade, my friend Mandy was so sweet to have me come and hang out with her family at her family's lake house west of here. And without me asking, she decided that she was going to show me how to use one of her mom's tampons. And I was like, okay, politely, like, you want to show me? Fine. Unfortunately, Mandy was confused, and I watched as she plunged that tampon right into her butt. Very funny, right? That actually happened. Even funnier is that I believed her. Luckily, I didn't need to use that for a couple more years, but that's a common theme that I see in pelvic health, is lots of times we have pelvic health problems because of a lack of communication, a lack of education, or a combination of both. I went to Padre Lopez High School. I was a dancing grade wave, and did a lot of dancing growing up, but in high school I was taught to use running as a coping mechanism, as a mental health tool, and I kind of fell in love with the healing power of exercise. I originally went to University of North Florida and then switched to University of Central Florida so that I could pursue a degree in molecular biology and microbiology. I had a goal of going to dental school. After dental school, I started thinking about how much time I spent drawing organic compounds and DNA and things like that. And I wasn't really excited to go back to school, especially to learn about dentistry. It didn't spark joy for me at that time to think about grinding on people's teeth. It made sense because my dad did it, and I was somewhat interested in it, but I couldn't bring myself to do it. I ultimately decided to go to physical therapy school at the University of St. Augustine. I never heard of the University of St. Augustine until I decided to apply to PT school, but it is exclusively a grad school for physical therapists and occupational therapists. Plus, it was pretty close to home. I met my husband Joe, and got married shortly after that. And then we had my daughter Kate. This is Kate. She decided to show up 2 months early. I was very unprepared. She showed up on the day of her baby shower. I was pretty stressed out about this baby shower because my husband kept inviting more and more people. Because obviously the more people you invite, the more free stuff that you get. But it was really stressing me out. So she was born on the day of her baby shower. It was a very traumatic experience for both of us, obviously. And I didn't do well physically for quite a bit after that. It was a huge struggle for me. I had a lot of questions about pelvic health. I had a lot of complaints about my body and how it responded and how it was doing. It just wasn't going well. I approached my doctor about it, a lot of people about it, a lot of clinicians, and really the response I got was, well, now you're a mom, this is kind of, it is what it is, this is your new norm, I didn't have any tools. So it got me thinking about a lot of pelvic health questions of my own. She's fine now. This is her. She's cycling in Colorado in this picture. She's 12.
Oh, wow.
So my early PT career, I started in commercial outpatient PT. If you've ever been, it's kind of like cattle farming. There are a lot of people. It's very loud. everyone's kind of doing something, but it's not really very good, not really very safe. It's not great for the patient or the physical therapist. The lifestyle was kind of brutal. I was in the clinic all day, sometimes seeing 3 to 4 people at a time, or seeing evaluations, sometimes 7, 8 evaluations a day, and then I would stay there 4 or 5 hours at night trying to catch up on my documentation, which left really no room for me to do anything for my family. So I transitioned from a clinic in Port Orange to Advent Health Sports Medicine in DeLand, which was better. I had only 1 patient at a time, which was a huge relief. But I had 6 PTAs, there were no PTs with me, and early in my career I really felt like I needed mentorship, other PTs to lean on, and it was pretty far away. So I decided to switch to Brooks Rehab in Ormond Beach. Brooks and Halifax have a joint venture clinic in Ormond Beach that was put there to manage the oncology population coming out of Halifax. Well, it was great because I had other PTs there that I could learn from. I was way closer to home, and I only had to see 2 patients at a time. Every once in a while, for the most part, it was 1 patient at a time. And then, this is me doing a silly video for them about self-cold massage. They also had free continuing education, and because they were an oncology specialty clinic, I got into a lot of oncology education, and I learned how to treat lymphedema, which is a swelling of an arm, a limb, a head, a neck, related to damage to lymph nodes. There's a huge need for that in this area, in most areas. This is what lymphedema looks like. Usually breast cancer impacts the axillary lymph nodes and can give you lymphedema in the upper extremity, especially if you don't prevent it or know anything about it. And then because of my own childbirth experiences, I started looking into pelvic health a little bit more. I took some classes on my own, continuing education that Brooks paid for. My first class was at Northwestern University in Chicago, where I learned about pelvic organ prolapse. Not a lot of people know about pelvic organ prolapse. I actually didn't know about it until I went to class that day, and I got to be the example in a group of 90 women of really severe pelvic organ prolapse, which was obviously from my traumatic childbirth experience. It's better now, but I learned a lot about it. And about every week, every second week at Brooks Halifax, I would see a woman coming in to see me that had unfortunately gone to the ER at Halifax, complaining of tissue bulging from their vaginal canal and kind of freaking out thinking that they had cancer. And that fear was usually followed by the embarrassment of, this is a very common problem and nobody told me about it. Again, lots of miscommunications, education, lack of communication in public health. I also had a local friend here. He's a concierge physician. He was a GI physician here for a long time, and he was asking me to see all the pelvic health patients. And I was kind of like, I don't really know very much about that. We only got 1 day of it in PT school, so I kept taking more classes. And eventually, Brooks said, well, you've taken so much oncology education and pelvic health education on your own that you almost have a board certification in women's health. Women's health is a bit of a misnomer because it's the highest level of education when it comes to pelvic health. It encompasses both oncology rehab and pelvic health rehab. Okay, so what is pelvic health certification? It's a residency program. There are only 2 hospital systems, I think actually 3 now, that offer a residency program to acquire a board certification in women's health. It's about 1.5 years of additional education, including clinical research, having a mentor come down and treat your patients with you 1 day a week, also having a full caseload of patients made up of at least 75% oncology and pelvic health patients. So very valuable education when it comes to pelvic health. If you don't know what you're doing when you're internally treating someone via the vaginal canal or the rectum and you don't know what you're doing, you are literally and figuratively in the dark. So to have somebody come down and be with you and treat your patients and check things out before and after you and say, yes, that's what this structure is. This is what that is, and confirm for you whether you're incorrect or not. So very valuable education. I'm very grateful to the Brooks system for providing me with this education. Also includes obstetrics, complex disorders, pediatrics. Huge population of post-prostatectomy men. So if you have prostate cancer and they remove your prostate, you're probably going to be completely incontinent for a minimum of 3 months. Sometimes that gradually gets better on its own. Sometimes we have other things going on like Parkinson's, and you need a little bit of help from a pelvic health therapist. You because this specialty is called women's health physical therapy, a man experiencing post-prostatectomy urinary incontinence may not be Googling where is a women's health specialist. But amongst pelvic health specialists, a women's health specialist is the most qualified therapist to see anyone with a pelvic health problem, no matter what their age or gender is. This is just a list of things that we treat. It's quite long, complicated names, but a simple way of thinking of who's appropriate for pelvic health, and the way to think of it simply is if someone is having a problem with pooping, peeing, sex, or pelvic pain, they should see a pelvic health therapist. Okay, so the pelvic health musculature is a very important group of muscles. It's responsible not only for continence, but supporting the bones of the pelvis and lower back, orgasm, keeping the organs from prolapsing or falling out. So pelvic organ prolapse can happen traumatically from a childbirth early on, or it can happen later gradually as we lose estrogen and the walls of the vaginal canal become more flexible and pliable. But there's a lot that we can do to manage it and mitigate it, especially if women are educated up front, which we usually are not. The most common pelvic health surgery in this country actually is called the sacropulpoplasty. They make us watch them in residency. There's a lot of cutting and burning that happens, but actually they take a piece of mesh, attach it to the top of the vaginal canal, use a mesh rope to pull it back, and attach it back here at the sacrum. So ideally we know what that condition is, what pelvic organ prolapse is, so that we can prevent it so that it never comes back. Okay, so here's some pictures of it. You can see up here normal anatomy. Here is a picture of a bladder prolapse or a cystoscope where the bladder is actually folding into the vaginal canal. Posterior prolapse or rectocele. And over here, uterine or midline prolapse. So all of those organs can kind of fold into the vaginal canal and cause problems. So in pelvic health physical therapy, it usually starts with an internal exam. It's called a perfect scale exam, and essentially I'm looking at what is the strength, endurance, and coordination in the pelvic floor muscle group. So to do that, I have them kind of undress from the waist down, tuck under a sheet, I check their nerves, their reflexes, take a look at the anatomy externally, see if there's anything that could be there. I test all of those things, and then from there, the exam may move outward orthopedically because a lot of the muscles involved in some of these things are also related to low back health and hip health. So I identify impairments. So are they lacking coordination? Are they lacking endurance? What can we work on to help fix the problem? And then the patient and I talk about what their goals are, which usually is returning to their prior level of function, whatever that may be. So if they're leaking urine, then it's usually we're focused on that. Whatever their goals are, we kind of develop a plan together and then try to go from there. These are some examples of interventions or treatments that are common in pelvic health physical therapy. Therapeutic exercise is kind of the standard in rehab for a lot of things. Biofeedback, surface electromyography is where I take EKG stickers and place them, one on the greater trochanter right from the hip, and that's like an electrical grounder, and the other two are placed perianally right over the pubillocutalis muscle, which is primary to the pelvic floor. We used to use a probe, but that's less consistent and less accurate and costs a lot of money, and usually it's kind of hard to keep in place. So now we just use EKG stickers. Way more comfortable. Everybody's more of a fan of that. We can do neuromuscular electrical stimulation to pelvic floor, which we never really want to do. We only do that in cases of really low strength, like a neuro patient. Similar to what we do for foot drop externally here at the anterior tib to elicit a contraction involuntarily from a muscle that's not firing. Dilator training. So part of, again, women's health physical therapy is oncology. So anybody with a pelvic cancer may or may not have a treatment called vaginal brachytherapy. So it's radiation delivered via a tube inserted into the vaginal canal with holes in it, radiates outward, and what that does is it essentially microwaves the tissue and makes it shrink. So you can see that's a big problem for women. So dilator training is really helpful to try and maintain that space and keep that canal open so that everything will continue to function. Manual therapy. So in residency, we're taught a lot of manual therapy interventions, which is just techniques things that we use our hands for to try to improve the health of their tissue. You know, rectal balloon training, that's a special type of treatment that we're taught in residency, and it's usually for rectal hypersensitivity or hyposensitivity. So bowel dysfunction patients, we use the rectal balloon training. But a lot of it is patient education. Again, we don't have great education in this country. When I was in residency and I had students, we used to give out quizzes to women coming into physical therapy about their anatomy. And I actually stopped doing it because people just got mad. They were like, I don't know any of these terms, I don't know where anything is. But it really is a huge problem. So I was at Brooks, Halifax, and Ormond Beach for more than 6 years. And the longer I was there, the more I realized that the outpatient setting isn't necessarily the best setting for women's health physical therapy for pelvic health physical therapy. It's very loud. There's no privacy. So you go in and talk to a front desk person in a waiting room with 15 people, and they're trying to decide, what to label your case as and what forms to give you. So it's very, very awkward from that standpoint. The wait lists were very long. So sometimes I would have hundreds of patients waiting for an evaluation, and sometimes they would come in for an evaluation, only to be told, well, it was really nice meeting you. I will see you again in 4 to 5 months, and there's another opening on my schedule. It's really disturbing. Front desk, customer service issues, so kind of, I guess, standard healthcare issues. So I decided that I was going to open up my own practice, and I called it Greater Daytona Women's Health and Physical Therapy. It's a little bit of a mouthful, kind of working on that. But it's more private. It's located centrally in the county. I'm actually right down the street here at 112 Orange Avenue by Stavros William James. I let patients access the schedule themselves. They can schedule, reschedule, see what's available. There's no wait list. And I'm trying to accept all insurances. Medicare and Medicaid are going to take a little bit longer. They want me to be in that location for a minimum of 90 days and actually send somebody out to work with me and get it what they want it to be. What can 1 million cups do for me? Spread the word about women's health. It's not just for women. It's for anyone experiencing a pelvic health problem or oncology patients. Let them know where I am and where I came from. So a good rule of thumb, if you're not sure if they're appropriate, is just think problems with pooping, problems with pain, problems with sex, pelvic pain, or cancer.
Thank you.
All right, fantastic. So, wow, I gotta take a breath here. That's a lot of stuff. I'm glad there's people like you that like to learn all those things. So, here's, for those of you who are new, we're gonna go around. We have questions, comments, ideas, anything to help Jill market and improve her business, grow her business. So raise your hand and I will bring the microphone around and we'll do it.
I feel wonderful presentation. Thank you for learning what is in so many households and so many lists a taboo subject. People don't like to talk about their private areas, so make it seems to me form to be a very comfortable environment to do that for people to openly share, which is wonderful. Now do you work with men? First question.
Yes, absolutely. So that's one of the things I kind of want to highlight today is the specialty is called women's health. But there are swaths of patients that are having prostatectomies that are experiencing really severe urinary, actually complete urinary incontinence, sometimes for that first 3 months after prostatectomy. So even though I'm called a women's health specialist, I'm the most appropriate physical therapy clinician to treat a male patient.
Wonderful. So the second question then would be, how are you marketing yourself and getting out to, because it's such a taboo subject, as I mentioned earlier, there's ways to label that as an empowerment, informative about your own bodies. And there's none of that sounds, well, that sounds fine, but I'll learn a little bit more about the body. There's nothing taboo that might be easier to, bring a group together and explain what it is that you do. Because everybody knows somebody that is, how did you put it? Peeing, pooping, or pelvic pain. Yeah, everyone knows, has a relative, a friend suffering with something, I'm sure.
Well, I haven't really gotten into that yet. So I'm just kind of getting my feet wet in this clinic, and I really haven't done anything to market to men other than, you know, I have previous relationships with urologists, but I'm not sure that they know that I'm here or where I am. I did send them a letter initially, but you know how doctors' offices are, who knows if anybody got that or read that. So that is a good idea, and we need to start working on that. Actually, post-prostatectomy male patients are some of my favorite. They usually really need help. They are really goal-driven. They usually ask me to do what I'm asking them to do. They get better really quickly, and then I never see them again. They're great patients. My favorite, actually.
They don't want to come back.
They don't want to come back. They stop peeing on themselves, and it's like, all right, nice knowing you, Joe. Yes.
So, I'll pass it to you, Laura. So, good morning, Jason Frederick. As a man, when I hear women's health, I do not think at all it is, you know, doing what you said you do. That just doesn't come into my, I think of other things. I'm curious, when women hear women's health, do they automatically think about what you do, or is it more OBGYN type stuff? And how do you get your brand out to make sure people understand exactly what you do? Because especially the fact that you had things for men in there. You know, my dad had his prostate removed, so I understand that. So how do you brand yourself to exactly explain it as what you do?
That's a good question. So, you know, it is called women's health, but I think not a lot of women are even aware of pelvic health, and pelvic health is more commonly recognized than women's health. So when they see that, they're probably like, well, is that pelvic health? Well, yes, it is. But you see how, like, I'm treating a lot of categories of things. So, but none of them, like women's health doesn't really direct them to that. So I do think it's a good idea for me to change my name. Open to suggestions about that. Yes.
I was going to say I have a suggestion, but I'll start with questions so I didn't mean to interrupt. I was excited to raise my hand.
Okay.
Lori, go ahead.
Apparently I've had too much coffee, and I have other people. She's really scary. Hi, Lori McMullen with your Daytona Regional Chamber, and just one thought, kind of a little bit self-serving, but we're neighbors. Our Chamber of Commerce is just on City Island there. So if you're ever interested in me coming by or you coming to check us out, we may be a good fit for you. You would definitely qualify for a ribbon cutting, and possibly a leads group might be up your alley. We have a chiropractor I'm thinking of in particular who's grown her practice in one of those groups. So
I'd like to do that. Thank you. It's a great idea.
Sean with Arrow Clinical Trials. Is everything you do from the waist down? Pretty
No.
much?
So when you think about cancer rehab, there are huge numbers of women with breast cancer. So breast cancer, if it involves mastectomy, where they remove part or all of the breast, lots of times the lymph nodes, the axillary lymph nodes are impacted. And when lymph nodes are damaged, there's potential for lymphedema. So I am one of the only therapists around here that can treat and manage lymphedema. So that's usually in the arm. Usually there's lots of impact to the shoulder as well. And I am by trade a physical therapist. I still have spent many years treating general outpatient orthopedic patients. That's not really the focus of my clinic, but I can do that as well.
My marketing, mine was wandering around waist down health.
I saw where you were going with that. I was gonna be there. And I don't know how all this works with referrals between doctor groups and providers of insurance. I know that's a whole world of things, but I think that's where you go. I mean, any doctor that knows you specialize in these type of things, you're just gonna, I don't think you need to market a ton. I think those referrals are gonna be, you'll build your entire practice that way. And I think the way to do that would be fairly old school. I know you've called into some of these places, but to have, you know, your bio sheet of what you do and all your accolades and hand drop those off into these groups that would be able to refer, because I think it's such a niche. Like, you do so many great things for people in need, but it's really hard if I just saw your business name, like, I have no idea. I have no idea what that is, but doctors groups that know you, trust you, and like you, they're gonna refer you all day long because they want the patients to get the right care, and I think that's what you do.
I agree, thank you. I think the challenge right now is, like, I've had a lot of doctors that have consistently referred to me over time, and even though I have tried to reach out to them, I'm trying to make sure that they still feel like they can trust me. I'm going from a really well-recognized couple of hospital brands, Brooks and Halifax, to now I'm out on my own. So just trying to make sure that a lot of those same referral sources trust me where I am to be out here on my own. And so they're slowly trickling in. I just got some from a local OBGYN group that has sent to me over time, a GI group. But yeah, hopefully they will continue to trust me. I know that there's a huge need for it. And like I said, there were tons of referrals, lots of times, like, just waiting for me, to the point that it was, not achievable, but hopefully they will trust me in this new location.
Yeah, I think all that, it takes time. It'll take time to build out, but yeah, and you're on the right track. I think you're probably helping, you're gonna get to a point where you're helping so many people, you're not gonna be able to help them all, and you're gonna run into what you were living in before, but you can hire staff and continue to do what you do.
Thank you.
Hi, Jill. Caitlin. You did a great job, by the way.
Thank you.
I wanted to just recommend, as far as getting the word out there, because it's such a taboo topic, I think education via social media is a game changer for you if that's not an avenue that you have pursued quite yet. Because not many people want to turn to their friend and be like, I have problems pooping, or I'm having pain with sex. Like, you don't have girlfriends to talk about that with. Like, that's really hard to find. But people are turning to the internet every single day for these questions and utilizing hashtags, copying your content across all social media platforms, I think creates a really cool opportunity for you. And I've never heard of it before, so I don't know if that's a path that you're seeing yet. But
Yeah, thank you so much. I actually have never really done any social media until, like, this week. So at Bamboo Athletics, if you're familiar with Coach Jay over in Norman, he's amazing. I don't know why they decided that they would trust me, but they did, like, a huge social media thing for me, and I did a seminar there and had a huge, great response to it. So I'm just now kind of trying to get started with that, which is a little bit scary, but they did most of it for me, luckily. But I'm trying to do that a little bit more. And it is really scary, and actually that's a huge privilege of this job. I really feel privileged that people will come in and talk to me and tell me what these really personal problems are. Lots of times it's really, really emotional, especially the first couple of visits. And I totally get that, and I hope that people can trust me with it and consider me, a trustworthy ear to bend and kind of like a soft place to land with it. Thank you.
Carlos, right back here again. I guess I'm finishing too. With reaching out to offices, like you said, doctors' offices, there's also, you do so much more than physical therapy. Physical therapists are trained to a degree, but you extend past that. It wouldn't surprise me at all that people that are going to physical therapist's office will recommend you because you go beyond that. Yes, you provide that service also, but there's an area where they can't touch, and they're working hard to help their clients or patients up further along, and you have a reach within each individual that they don't touch. And that might be an avenue for you also to partner with by going to, there's lunch and learns, there's all sorts of things that are out there, seminar sessions that are open to the public that, hey, you just have to register, and then you'll find out which office is leading how far, and say, well, listen, if you find yourself that your patients, your customers need beyond that care, I have this available. And I'm sure, that's why you're medically trained, you're wanting to improve the health of whoever you're working with.
That's a good idea, Carlos. Thank you.
Sure.
Also, want to recommend the social media impact on your business can be really tremendous. I would say 98% of our referrals for Aero come through social media marketing. It is a big game changer now, and it's very affordable. Now we're finding out that, hey, we can do this ourselves and creating our own ads and generating just as many leads, but what we found out was leads are coming to us from, they're the same leads that came from the service we hired. So what I mean is, they went out and did a social media campaign and we got those referrals. We went out and did a social media campaign and those same clients, potential clients, were responding to our ad. So we're getting to where they're looking.
Yeah.
And now we're like, wait a second, maybe we can eliminate that middleman for our social media and save us a ton of money. But there are companies out there that can take what you do and brand you and get you out there for a very reasonable amount of money to generate quite a bit of referrals.
Yep.
And I can share those companies with you. They're nationwide.
That
So,
would be
and
great.
they specialize in this arena of medical and trials and so forth. So I'll do that.
Very cool, thank you. Like I said, I've done none of that, so I'm not very good at like videos or, Leonie did a great job, like, making these videos, like, couldn't do it myself, so that's great, thank you.
Hey Jill, Valerie here. Congratulations on your 1 million cups presentation. And you did say that the name of your company is a mouthful. So you do recognize that it is hard to kind of like remember. So maybe think about like maybe shortening up. And I love what you wrote there, that you have to be board certified in women's health. I didn't know that. So I do want you to keep the women's health specialist in there, but like maybe women's health PT. Shorten up so that you can practice saying it as often as you can, and people will say it for you as well. And piggybacking on social media, it is a lot cheaper than you think it is. Don't put your marketing towards the end of the budget. This is 2025. That should be part of your plan of growth. Not just social media, but look into making sure you have the right keywords for your website. So we have a couple of like SEO specialists in here. You can reach out to them. I can give names. Tom is a good Google SEO. He's right here, me on my back, right here. And it's, again, the leads that were coming and referral, apart from your soft leads, your connection in the community from Brooks Rehab and all the rehabs that you knew, and doing all the cold calling. Let the internet, like Google Ads or whatever SEO, do it for you as well. Make sure you have a robust form so that patient know where to find you. And keywords are everything. It will point you to the right direction. Apart from the education piece, do an open house. Talk about, I'm repeating every what everyone is saying here, essentially. But yeah, so consider having a shortened form of your name, like your brand. Work on that, and then 3 keywords that will spell out specifically what you do, so it's memorable. Pooping and sex. But I know lymphedema I know a little bit of a lymphedema specialist in Port Orange. But so I know, like, I've seen it like advertising, but I didn't know that you have it too. So that's it. You get a lot of patients just for lymphedema. Just try to do like a focus just for your branding and logo, and then you can list all of the services that we also treat this. But for education and for people wanting to remember your services, just try to point out like top 3 general, and then you can get into the nitty-gritty on your website.
Thank you so much.
Joe, one of the things I had a couple years back, I had a weird issue with my eyes, and what I was disappointed with was the referrals that I got, the doctors that I would see, that their general practice kind of eye doctors, they didn't know what to do. And so they would refer you around. And I think there's a lot of that in your situation. People don't know that there's necessarily your expertise and services, even in medical profession. So a lot of people who are in kind of dire straits and feel like they have a need, but they're not even sure what they're looking for. for. They're just out there Googling symptoms and what their problems are. What ended up happening was I found a guy in Minnesota who actually knew what it was, and he referred me to the guy who fixed it all. He was great. You have 900 other practitioners with your certification around the country. That should be a really good pool of knowledge and resources to put out there on the internet. So when people are searching, they may not find you, but they'll find somebody who can then refer, you know, whether it's in Colorado or Minnesota, they can then say, hey, I know the person in Daytona to do this, and refer you. The other thing I want to suggest was on your website, putting detailed layman's terms information about the kinds of cases you handle would be really valuable. Somebody will be Googling, I have problems pooping.
Yeah.
Not
Not.
whatever the
Prisoner defecation.
there you go. Yeah.
Why would I would
wouldn't know to
Google that.
search for that. I just know I've got a problem pooping. And so those are kinds of,
Problems with number 2. So.
there you go, problems with number 2, yeah.
Yeah.
Those are the kinds of things. So that's my suggestion. Put lots of detailed information in layman's terms and say, I fixed this.
Yep. And
Yeah.
testimonials too.
Yeah, testimonials are tough in her business because
You don't
You
have
just
to
do
like put
blind,
in, you don't,
yeah.
you can do like anonymous or like, you know, just, you don't,
Yeah.
yeah, but just,
Anything
these are
else?
like
Anything
treatable
else?
cases. Yeah.
All right. Hey, thanks so much. We had an eye opener today, didn't we?
You sure did.
That's great. Did you do a good job?
Yes!
Now, the last question is, what's the one thing that this one entity community can do for you when we leave here? How can we help you grow your business?
Maybe help me think of some names that are shorter, that are catchier, that people.
Women's Health PT, Women's Health PT.
I don't think
Yeah.
it's women's health.
I
It's
don't
I don't
know, I
know.
feel like there's something flashier I could do. and
But
more.
no,
I
but
don't know.
like she
I'm open.
served.
Daytona BT.
That's
Like
her.
Atlantic
Atlantic
Health.
BT, yeah.
Like Atlantic Health.
Lori had one?
No.
Bottoms up. Yeah, that's good. I feel like there's
Oh, that's
something.
right.
You don't want to be associated with that word here.
I charge you.
Thank you guys.
Thanks.
Jason has like a lot of good experience.
Atlantic Health.
Mandatory photo, Val.
Yes, yes. Yeah, sorry.